Welcome to Health Today. I'm your host, Sonya Jones, and today I'm here with Dr. Fred Richardson. Dr. Richardson is a family medicine doctor here in the Effingham area. Doctor, thank you for joining us today.
Thanks for having me.
Why did you choose to become a family medicine provider?
Because it allows you to see folks at all ages, all throughout their lifespan, and there's no restrictions on what you can and can't do. As an internist, I may only be able to see adults. Whereas in family, I can see everybody from birth all the way till death. And so I enjoy not having any restrictions on me as I practice.
So do you have a lot of families as a family medicine provider, or do you just have a lot of individuals?
Well, it starts individually, and then they all come from families. So we always practice in the context of a family, and so you end up getting those families. Even on home visits, you get an elder person, and then you get their family. So the families is an outshoot of the practice. You know, do you have kids? Do you have a sick grandma at home? What's happening that brings you here today with whatever you're coming in with? For example, if you have high blood pressure and you're stressed out, well, where's the stress coming from? It may be family, maybe job. So everything is kind of in the context of what surrounds you. What's your environment? And that's the philosophy of family medicine.
So Dr. Richardson, what most of us know about a family healthcare provider is that we come into your office, but you do things a little differently as well. Your office isn't just in the office, you go out as well too, is that right?
That's true, and so we actually bring the office to that person's home. So if you're elderly and you're homebound and can't get out, then we actually bring the office to you. So if they can't get out and get to you, and they're kind of homebound, then you're kind of obligated to go in and check on them. It also keeps them from coming into the hospital. So a lot of folks with all these readmission rates being so high, we don't see a lot of that because we take care of them in their home.
Well, you said something that I found interesting. You said we're obligated to go out and do that, but that's not really true, is it? A lot of places don't do that, but here at HSHS Medical Group, we have a desire to put patients first, and it sounds like that's exactly what you're doing.
Well, one of the reasons I came out here was because of that, that the patient is the focus, and then the family is next, and we do everything within the confines and the context of family care. Their concerns are our concerns. Whatever's important to them is important to us.
What is it about being a family practice provider that you find the most rewarding?
Just becoming almost a member of these families, and they trust you with all their family secrets, and they tell you all sorts of things, and they really believe in you. So you develop a trust relationship that's at the heart of medicine. You can't do a visit in 5 minutes when you're dealing with a patient and their families. It takes time. And so you develop that trust and that bond, and I think that's what really drives me.
Dr. Richardson, if you could give all of your patients, everyone, one piece of advice about maintaining their health, what would it be?
Probably to establish a relationship with somebody in primary care that you can trust, that you can believe in. Stops you from going to the ERs, stops you from being admitted to the hospital over and over again. And in the middle of the night, if you have a problem, you have someone you can contact.
Dr. Richardson, I can tell that you have such a heart for your patients. And if I lived in the Effingham area, I think I would certainly choose you.
Oh, thank you. Thank you.
You are certainly all that HSHS Medical Group stands for, and I appreciate your time so much.
Thank you for having me, and it's been a lot of fun.
Thanks so much for watching Health Today. We'll see you next time. Thanks for watching Health Today. Be sure to stay up to date on future episodes by clicking the subscribe button.